Welcome to the House. Thanks for coming. I call on Senator Jerry Buttimer now to bring forward his commitment.
And can I welcome the Minister to the House on today, World AIDS Day. It's a worldwide day, Minister, as you know, with the theme of global solidarity, shared responsibility in fighting the stigma of HIV and AIDS in our country and in the world. And I place this commencement matter, and I thank the Cathaoirleach for allowing myself and Senator Warfield to have two different ones on World AIDS Day around sexual health strategy, which for this 5-year period, Minister, is about to expire. And I hope it doesn't just run out, that the strategy, the next one, is consultative, is collaborative, because it is important that we renew our focus on tackling HIV through rapid testing, accessibility and collaboration between all the stakeholders involved, the NGOs, and in particular to pay tribute to the Sexual Health Clinic in Cork and HIV Ireland for the work that they're doing, but also the state agencies under your remit as Minister, and to compliment you, Minister, for the work that you're doing as Minister in the time that you're in the position. And I know you've been very proactive and very active in this particular issue. Minister, the Sexual Health and Crisis Pregnancy Programme has helped to fund and provide seed capital, in terms of our aspiration under Healthy Ireland to tackle the stigma of HIV, to reduce the numbers. And I know that the rates for this year are on a par with previous years. There is a worry about the trends. Our focus must be on achieving the goals and also on maintaining funding. As a country, we have signed up to Fast Track Cities, the global partnership with the 90-90-90 outlook and outcome, and all of us, Minister, must be committed to making testing easier, that we all know our status, that community testing is made available, that we raise awareness, and that we reduce the stigma that still exists in terms of the context of HIV. Cathaoirleach, could I, in the context of Cork, and Minister, pay tribute to the staff and the leadership of the Sexual Health Centre in Cork, who are performing Trojan work. During this pandemic, their outreach, their support programme, their counselling has been available. In fact, they've been open in terms of HIV STI clinic operation throughout the whole programme. And it's a facility, a service available to people, and they must be commended. Minister, the issue of our urban centres is one that is not necessarily an issue. I know Senator Warfield will have a commencement matter in a minute on a particular matter, but visibility in our rural settings is one that needs to be addressed in terms of equity of service, in terms of equity of availability and access to services. And somebody made the point to me, Minister, is an air code the dictating feature of access to service? I certainly hope it's not. Can I finally commend HIV Ireland, who've been to the forefront in our battle and in our response to HIV and AIDS for over 4 decades. In reflecting, as many of us do, Cathaoirleach, remembering our many friends whom we've lost, we recognise today that we're in a better place as a country, because in the furtive early years, there was a social policy being led and changed by NGOs and by activists. Today it's a government-led, and that's why the red ribbon, the symbol of HIV/AIDS Awareness Day, is one that we should be proud to wear. So, Minister, I thank you for being here. I look forward to your response. Our journey continues, and I am very proud that you are here to wear the jersey in this battle, in this quest, and we are lucky to have you as that Minister. And I say that genuinely as a person who knows you a long time, of your genuine commitment to people. Gramagat.
Thank you, and I'd like to thank Senator Buttimer for his remarks. And the National AIDS Strategy referred to by the Senator was published in 2000. Its most recent successor is the National Sexual Health Strategy 2015-2020, published in 2015. The National Sexual Health Strategy aims to improve the sexual health and well-being of the population and to reduce negative sexual health outcomes, including unplanned pregnancies and the transmission of STIs, including HIV. These aims are being addressed by delivery of a programme of work to improve education and prevention supports, sexual health and STI services, and the quality of health information used to inform policy. The vision of the sexual health strategy is that everyone in Ireland experiences positive sexual health and well-being, and the strategy has 3 goals: that everyone living in Ireland will receive comprehensive and age-appropriate sexual health education and or information and will have access to appropriate prevention and promotion services; that sexual health services which are equitable, accessible and of high quality will be available to everyone; that robust and high quality sexual health information will be generated to underpin policy, practice, service planning and strategic monitoring. A mid-term review of the strategy in 2018 found that implementation is going well. There is great working relationships between voluntary and community groups working in this area, and the HSE's Sexual Health and Crisis Pregnancy Programme, or SHCPP, who manage the healthcare services covered by the strategy. Tackling the recent rise in new diagnoses of HIV and other sexually transmitted infections is a key element of the strategy, and last year saw the launch of a number of major actions to combat these rising rates of infections. In June 2019, Ireland formally became a member of the HIV Fast Track Cities initiative, a major global partnership committed to accelerating local HIV/AIDS responses. Dublin, Cork, Limerick and Galway have joined this network, and 450,000 in funding was provided in 2019 for implementation of local actions such as increased access to HIV testing. The most significant development in 2019 was the introduction of a national programme of HIV pre-exposure prophylaxis, or PrEP, which involves the preemptive use of antiretroviral medication to prevent HIV infection. PrEP is provided within a holistic prevention service which includes regular monitoring and testing, as well as advice and counselling on safer sex practices. Funding of 5.4 million was provided in 2020 to allow a full national rollout of PrEP and to fund additional staff and other resources required to provide HIV PrEP within a broader sexual health and HIV prevention programme. Other important actions undertaken by the SHCPP include support for parents, with a range of booklets having been published recently to enable them to talk to their children about relationships, sexuality and growing up. The SHCPP also provided support for the provision of relationship and sexuality education in schools. The programme plays a vital role in developing research, collaborating with, for example, the ESRI to reduce the evidence-based information which is vital to understanding emerging trends. And the future direction of the strategy will be reviewed, Senator Buttimer, in 2021.
Thanks. I'll give you 1 minute now.
Yeah, thank you, Carla, and thank the Minister. It is important, Minister, that we live up to our expectations around fast-track cities, that there is a combined collaborative approach, and that we continue to be to the forefront in responding to the HIV/AIDS. And the funding, Minister, of €450,000 announced last summer is one that we need to see matched again in future years. And I do hope that the community-based testing, the outreach services, the public awareness campaigns are continued. They are so necessary, as well as the whole issue around PrEP and the availability of PrEP. But Minister, the elimination of the stigma, the raising of education and awareness, and the continual promotion in terms of young people and not so young people is very important. But go on.
Thank you. 23 public STI services nationally provide 3 STI HIV testing, and HIV testing is also available as part of the National Antenatal Screening Programme with almost 100% uptake. The HSE Sexual Health and Crisis Pregnancy Programme funds and collaborates with community partners to expand HIV testing amongst higher risk population groups such as gay men and migrants in order to identify those living with undiagnosed HIV. Two of the most important partners, again, are HIV Ireland and the Gay Health Network, and I was delighted to meet HIV Ireland yesterday at the launch of another facility in the Matter in Dublin. HIV Ireland is funded to support a programme called Empower, which provides testing and outreach support to gay and bisexual men, both online and in face-to-face capacity. Funding is also provided to the Health Network to manage demand-to-man, i.e. website, communications, messaging and campaigns to ensure that gay men have access to appropriate information on sexual health and available services. And further information links are also available through www.sexualwellbeing.ie. To conclude, I would like to take this opportunity to note the importance of World AIDS Day in raising awareness of this illness, which is a key element to keep infection rates as low as possible. And we will continue to work as closely with all our key partners and stakeholders in this important area in order to make best use of resources and to continue to fight against HIV and, as you said, Senator Buttimer, stigma.